Good afternoon, everyone. My name is Tandiwe Menze. Thank you for joining us this afternoon. And just a few technical issues before we begin. Please note that my moderator, Mr. Vuyo Ntamo, who's joining us online, will be sharing the diagnostic survey at the beginning of the session that you need to complete. This will be at the beginning. And right at the end of the session, my colleague will share the summative survey. Okay. Our technical issues have been resolved. I will now begin the session. And thank you once again for your patience. The title of this afternoon's session is an introduction to literature, systematic and scoping reviews. And I have just provided a definition between the three. So the first one, what are literature reviews? The definition, a literature review is a survey of scholarly sources on a specific topic. It provides an overview of current knowledge, allowing you to identify relevant theories, methods, and gaps in the existing research that you can later apply to your paper, thesis, or dissertation topic. Okay. When to use literature reviews. Literature reviews are crucial at various stages of academic and professional research to ensure a solid foundation. So you would use a literature review before starting new research to identify gaps in current knowledge and ensure your study hasn't got duplicates or existing work. You would also use a literature review for thesis, dissertations, and projects to situate your own research within the context of existing scholarship. You would also use a literature review to map a research field, to understand the history, key theories, and methodological developments of a specific topic. You'd also use a literature review to resolve conflicts, to compare contradictory evidence from different studies and provide a clearer picture of a controversial issue. Finally, you would use a literature review for evidence-based practice to summarize findings that inform decision-making in fields like medicine or policy. And the next one, what is a systematic review? A systematic review is a summary of research results or evidence that uses explicit and reproducible methods to systematically search, critically appraise, and synthesize on a specific issue. It synthesizes the results of multiple primary studies related to each other by using strategies that reduce biases and errors. When would you use a systematic review? You would use it if you want to identify, appraise, and synthesize all available research that is relevant to a particular question with reproducible search methods. The limitations of using a systematic review. It requires extensive time as well as a large team. We are then defining scoping review. Scoping reviews are often used to categorize or group existing literature in a given field in terms of its nature, feature, and volume. When would you use a scoping review? To label a body of literature with relevance to time, location, country, or context. Source, for example, peer-reviewed or gray literature, and origin, for example, healthcare discipline or academic field. It is also used to clarify working definitions and conceptual boundaries of a topic or field, or to identify gaps in existing literature or research, and the limitations of using a scoping review. There are more citations to screen, and it takes as long or longer than a systematic review. Larger teams may be required because of the larger volumes of literature, different screening criteria and process than a systematic review. So before you begin your systematic review, you would have to define the study that you're undertaking. So you would need a question framework. First, you would define your research question. The research question is the basis upon which the review is conducted. If the research question isn't designed correctly or cannot be answered, it will need to be revised or altered. The search question guides the review type. What are question frameworks? A framework question allows you to structure your research question to answer your question. They are the foundation upon which reviews are built and is one of the earliest steps as well as the most important. So a well-designed question will frame your entire research process. It will determine the scope and rationale of the review. It will focus the search and identify key concepts. And it will also guide the selection of your papers during screening. So there are different types of framework examples depending on the field of study you're in. The first example is the PICO. So to define the PICO question framework is used for clinical and healthcare related questions. This structure is meant for quantitative studies, but it isn't exclusive to this type either. The elements of a PICO question, you have the P, which denotes population, I denotes intervention, C denotes comparison, and O, the outcome. Example of a PICO question. In patients with type 2 diabetes, does regular exercise compared to dietary changes alone result in better glycemic control? So in this question, the P, which is your population, would be the patients with type 2 diabetes. The intervention that needs to be undertaken, regular exercise. The comparison, dietary changes. And the outcome, better glycemic control. Continuing on PICO, the variant frameworks for PICO. The P, population exposure outcome, population exposure comparison outcome, and time frame, population exposure comparison outcome, duration, or results. The second framework example is the SPIDER. The definition of a SPIDER. The SPIDER question framework is used for qualitative or mixed methods research topics. The elements of a SPIDER question framework, the S denotes sample, PI denotes phenomenon of interest, D denotes design, E denotes evaluation, and R denotes research type. An example of such a question: what are the experiences of healthcare workers in managing stress during the COVID-19 pandemic? The sample, healthcare workers. These would be nurses, doctors, and other frontline staff working in hospitals and clinics during the COVID-19 pandemic. The phenomenon of interest, various stress management strategies implemented during the pandemic. The design, semi-structured interviews or focus group discussions. The evaluation, That would be thematic analysis of interview transcripts to identify recurring themes. And the research type, qualitative data. The next framework example is the SPICE method. The SPICE question framework is useful for qualitative research topics, evaluating the outcomes of a service, project, or intervention, and mixed method types as well. The elements of the SPICE framework example, the S denotes setting, the P denotes perspective, and the I denotes interest. The C denotes comparison, and E denotes evaluation. The example, what is the prevalence of smartphone addiction among adolescents in urban areas compared to rural areas? The setting, that would be your urban areas. The perspective, adolescents. The interest, assessment of smartphone addiction using standardized scales. The comparison would be the comparison of smartphone addiction prevalence rates between urban and rural adolescent populations. And the evaluation would be the quantitative analysis of survey data collected from a representative sample of urban adolescents. The next framework example is the PCC. The definition of a PCC, useful for qualitative and quantitative, that would be mixed methods, topics, and is commonly used in scoping reviews. The elements, the P stands for population, C stands for concept, and the last C stands for context. The example question would be, what are the experiences of first-generation college students in accessing and navigating mental health services on campus? The population in this question would be first-generation college students, and that is the acronym. The concept would be the challenges and facilitators encountered by first-generation college students when seeking mental health support services at their university or college. And the context, a qualitative exploration conducted at a college or university campus. Okay. So we are going to use the example of PubMed. Sorry. Okay. Before I begin briefly on PubMed, I just need to add that when synthesizing your data, there are various tools that you would use for synthesizing. And the example of the tools would be tools for evidence synthesis. The second tool would be evidence synthesis standards. The second tool would be literature searching tools, screening tools, data extraction tools, meta-analysis tools, critical appraisal checklists, the grading the strength of evidence tools, as well as risk of balance, risk of bias tools. I will exit the PowerPoint. Okay, so this is just an example. So for the exercise that we're going to use a database, but before we begin a search in the database, remember I said that you need to define your question properly. So we're going to identify the PICO elements from the following scenario. So the example that we have before us, so the scenario is, as a school nurse in a local high school, you notice an increase in teens that are vaping. You'd like to do some research into the possible negative health effects of vaping so that you can provide students with factual materials to help them stop or reduce their smoking. So that's a scenario. When applying the PICO method, the P, which stands for patient or problem. So how would you describe your group of patients? The group of patients in this particular scenario would be high school students or teenagers or young adults. The intervention in the scenario, what main intervention are you considering? So you are considering providing materials on negative health effects. And the comparison, what is the main alternative to compare with the intervention? The comparison is not providing materials on negative health effects. And the outcome, what can you hope to accomplish or measure or improve or affect? The outcome, to help students stop or reduce smoking. So from the scenario, you want to identify your question. Will providing materials on negative health effects of vaping help teenagers stop or reduce their smoking? So that is the question. So you need to identify the keywords from your question. So when identifying the keywords, would the keywords be health effects, vaping, teenagers, or education? The answer would be B, C, or D, but you could also add health effects in your search query. So I am now going to go to the library website. So we're going to do a search in a database. So this is the library website. We are going to use PubMed as an example. On the landing page of the library, to access databases, there are one of two ways to access databases. You can click on the databases A to Z on the landing page. Now, this works if you know the exact database or the name of the database that you want to visit. Alternatively, if you are new in the research domain and you don't know the various databases that are available within your particular subject, then you would go to Access My Subject Guide. So there are subject guides which have been created for all the subjects which are taught here at Rhodes, and the subject guides collate all the information resources that you need for your particular subject. So if you don't know which databases to explore, you would then visit your subject guide. But since we know that we're going to be using PubMed, we're going to click on databases A to Z. So the databases are grouped according to the various alphabets. PubMed will be under P. You click on P. And there's the link to PubMed. So if you have been attending the various workshops on how to search databases, you would have noticed that with some databases, the traditional databases, you'll have to use Boolean operators. But with some other databases, then you can get away without using Boolean operators. Those would be and or not, or even truncation. So for this particular database, you can simply type in your keywords and do the search. So it's not required on this particular database. Okay, I'm going to clear all. Okay. So I have a total of 361 results. Okay, you see it's asking me, did you mean health effects of raping? No, that's not what we meant. So I'm going to delete that. So these are the results that we have on the scenario that we spoke of. On the left-hand side of the screen, you can already see that you can limit your search results to the various. So if you were looking for systematic reviews, you would then select systematic reviews or review. But at this point, we're not going to do any selections. What we're going to do is, remember I spoke about the tools that you might have at your disposal for doing reviews. So I'm just going to give you an example of one tool that you might use, and that is Ryan. So we're going to upload the results on Ryan, and we are going to use limiters on Ryan. So this is just an example of one of the tools. On this particular platform, there's a free version and there's a paid version, but we're going to use the free version. Okay. And on this particular tool, you can use your RU login details to log in. You don't have to create a new password. Okay. I'm just going to click on login. Okay. I'm going to click on Google. So it's already picking up. This is the email address I want to use because this is my work computer. It's going to pick up my RU email address. Okay, so when you sign in, it will ask you, I see that it skipped that stage, but when you sign in, if you are creating a new, it will ask you for the title that you would want to name. It will ask you if you want to include collaborators, which you can do. I've already saved the 361, but let's go back to PubMed. The reason I saved it offline is because sometimes if you're doing a workshop, you might encounter glitches and then it doesn't work as well. So it's best to have something saved. Okay. So I want to save the 361 results. I'm going to click on the save button. So I want to save all the results. And the format, you can decide the format. I want to use the PubMed format. And I create the file. So it's done loading. So it's downloading the results, all 361 downloading. On my computer, and I'm going to save. Just going to change the and I need to choose the appropriate destination as well. Okay. Today's session, save. The results are saved on my PC. Go back to my Ryan reviews. So I'm using the tool to synthesize. I want to create a new review. Give the review a name. Just going to say testing, review type. So you can choose systematic, literature, let's say not applicable. We'll leave it at not applicable for now. Biomedical, description, and create. Okay, so on the left-hand side, it's showing you the supported formats. And then the next step, I want to select the file that we just saved on our computer. So yes, this is the one, and open. So it's uploading a file. Okay, so you can select up to 10 files, but for now, we're just going to use the one. And continue. And if you are working in a research group, you have the option of inviting members, or if your supervisor prefers, then you can invite your supervisor. Okay, the upload is successful. And then the next step, invite members. See. I'm inviting my colleagues. I haven't asked them for permission. I'll invite two. User role. So you decide, are they collaborators, reviewers, or just a viewer? Let's say they are collaborators. Of course, you want to add a substantial reason, but I'm just going to keep it very brief and invite. And they should get emails. And then accelerate your review with collaborators. Purchase seats. Nope, we don't have money for that. No, we're not going to upgrade. It's telling me there's a network error. Okay, I'm just going to close. Add references, add references. Okay, They've been invited. Resolve duplicates. The next step, you want to resolve duplicates. Okay, so this is the dashboard. And this is the file that I uploaded, the testing file. And these are the documents, all 361 from PubMed. The next, I am going to click on detect duplicates. So without you having to go through the 361 to see which one's a duplicate, you're going to use this tool to help you. Proceed. So it's checking from the 361. And there are 2 duplicates. You want to have a look at them? Okay. Okay, so we've done. Then you want to resolve. Perhaps you want to remove them. Okay, so these are the 2 duplicates. So you can decide if you want to keep the duplicates or if you want to delete them. And of course, maybe you want to read clarity. I'm refreshing my page and I notice that it is slow. Closing that. And I'm going to move that icon because it's blocking me. Okay, so this is an overview. We are on the overview. We're going to review the data. Click on the review data panel. So these are all the articles. Remember, we had uploaded 361. We searched for duplicates and we found that there were 2 duplicates. We removed the duplicate and now we're down to 360 articles. And on the filters, so if you're doing reviews, you've got your inclusion and your exclusion criteria. On the left-hand side of the screen, it's giving you possible exclusion and inclusion. So you can, I'm going to click on show more. So these are all the inclusion criteria. And at the bottom, these are all the exclusion. So let's select all the inclusion criteria from, so now it's showing us 72 out of the 360. And of course, do you see the ones right there on top? So for Pico, run Pico filters. Okay, remember we're on the free, so it's limited on what we can do. Auto resolve. We've already detected duplicates. Filters. So these are all the filters. So I applied all the exclusion. No, it was the inclusion first, and I was left with 72. And these are all the articles. When I apply the inclusion. And on the left-hand side of the screen, it tells you what you've already done. You've deleted one, which was a duplicate, and there is one that is not resolved, but we're not going to resolve that. Criteria. So the screening criteria is only the inclusion criteria, and we've omitted the exclusion criteria. And you can add additional screening criteria if you found that the ones that were detected by this particular tool are limited, and you can add your additional criteria. You have the option of screening. I'm thinking that we are having a network problem. Let's wait. Sorry, okay. There. So you can screen. So you would have to screen the articles individually. So if you want to keep the article, you would click on the include. At the moment, it has blind mode. So remember, I sent emails to two of my colleagues. So all three of us can screen the articles, but when we're screening the articles, it's blind screening, which means that my colleagues are not going to see which articles I'm including and which ones I'm excluding. So if you're working in a group, then if later on when you've completed the screening process, you can have a meeting and have a discussion on why you included some articles and why you excluded other articles. Okay, so I'm going to click on first one I want to include. So I have included it, and it's telling us, there's my name, it's telling us who has included the particular article. If I go to the second one, and I'm not so sure about it, then I would give it a maybe. So maybe I would require my other two colleagues in our research group to weigh in on the article. And if I go to the third one, and I'm definitely certain that I don't want this particular, and then I need to exclude. And I can provide a reason. So this would be the reason that my two colleagues in our research group would need. Maybe I can select one or two and apply. And of course, my colleagues can weigh in on that. And I'm going to click on Analyze. I've only done 2 articles, so let's see what Analyze. Okay, remember, we're only using the free mode, so there are limitations on what you can use and what you can't use. So you would have to get an institutional license. So for some research groups, you can get an institutional license for that. But presently, RU does not have a license. So we are on the free mode option. Yeah. I'm going to leave it at this point. And I want to check the chats to see if there are any questions. Remember, this was basically an introductory session. The 1 hour is not enough time for us to explore the various tools that are available. But I do invite you to contact your specific subject librarian if you would want to explore these further. I'm just going to have a look at the chat. Okay, So my colleague Vuyo has shared the first link, the diagnostic, and I'm hoping that you would have completed the diagnostic that was before, and we have come to the end of the session. I see that we don't have any questions on the chat, and I just need to go back to the PowerPoint. Okay, so a bit of housekeeping. My colleague is now going to share with us the summative survey at the completion of the survey so that you can take the summative survey. The feedback is very important because it allows us to better our workshops, and perhaps we need more time to work on these, but this was an introductory session, so it was not meant to be very long, but we do welcome your input. And I'd like to take this moment to thank the technical assistance of, okay, for this afternoon, there was a change in staff. So the technical assistance was from Mr. Castro and not Mr. Alistair, but we'd like to thank the whole division, the technical support division, who are always on hand to assist us. Okay. I don't see any questions in the chat. I see that my colleague has shared the summative survey. Could you please help us in taking the summative survey? I'm not going to close the session now. I'm going to allow you to click on the link which was shared in the chat so that you can take the summative survey. Your input is very important. And I'd like to take this time to thank Mr. Vuyo Damo, who was serving as the moderator this afternoon. And I would like to thank the in-person and online attendees. Thank you for taking the time to visit us here at the library. And thank you for taking part in the sessions, the workshops. Okay. Thank you.
I've got a question.
Okay.
So this whole idea is, can you basically say it's for us to like narrow down literature that we're going to use for our literature?
Yes, yes. Yep. Okay. Okay, I'm going to close the session. I see that there are some online attendees that are leaving, so I will close the session. And thank you once again for attending both the online as well as the in-person. And we will see you next week. Thank you and goodbye.